In a moment, I'm going to demonstrate two specific chiropractic adjustments to the neck and the upper thoracic spine, the same adjustments I do with my patients. Many people turn to exercises, supplements, and even medications to reduce their dizziness. Unfortunately, these remedies may not always correct the root cause of the dizziness. The problem with this is that even if the dizziness symptoms go away, with these remedies, the relief may be temporary at best, and the dizziness can keep coming back. In this video, I'm going to show you a more permanent solution you might not have considered for your dizziness: chiropractic adjustments, specifically targeting the cervical spine, the neck. I'm going to explain how misalignments of the cervical spine could be the unexplained cause of your dizziness. Don't miss this part of the video, because it could be the very reason your dizziness has not improved or resolved. I'm also going to explain how and why chiropractic adjustments work to correct these cervical misalignments. And I'm also going to demonstrate these adjustments in exactly the same way I would perform them with one of my dizziness patients. You'll be pleasantly surprised in how specific, gentle, and safe chiropractic adjustments are for correcting cervical spine misalignments in the dizzy patient. And if you're wondering, no, it does not involve any quick rotations of the neck like you might have seen in other neck cracking YouTube videos, even some of the parodies. And be sure to watch right to the end for today's Recovery Spotlight. It's a new segment I'm introducing in my videos where I highlight and share a related patient story. Today, I'll share about Sing Yan, who had multiple moderate concussions in her early athletic 20s and had dizziness as one of her main post-injury symptoms. And I'll share how her dizziness recovered under chiropractic care. No matter what you're going through, there is hope. The body has a remarkable way of healing when supported properly, and this starts with a healthy spine and the nervous system free of interference. Hi, I'm Dr. Joshua Gelber. I'm a chiropractor in the Annex area of Toronto, Ontario, Canada. We focus on helping people overcome headaches, dizziness, vertigo, neck, shoulder, and back issues through specific chiropractic spinal correction techniques. But before I dive in, I need you to smash that subscribe button if you want to enjoy a more comfortable and active life with better posture, increased mobility, and free of chronic pain. There are three key reasons why dizziness is particularly worrisome for many people, especially when it's persistent and doesn't go away. First, it impacts daily functioning. Dizziness can severely affect a person's balance and stability. It'll make everyday tasks and activities challenging. It can lead to difficulties walking, driving, working, even performing simple household chores. And obviously it can have a significant impact on your quality of life. Then there's safety concerns. The loss of balance and the potential for falls associated with dizziness. They raise serious safety concerns. Falls can result in injuries, fractures, other health complications, especially in older adults. Third, there's a difficulty with diagnosis and treatment. One of the biggest frustrations for dizziness patients. Dizziness is a symptom with lots of potential causes, which can make it difficult for some healthcare professionals to diagnose and treat effectively. The process of undergoing multiple tests and treatments without resolution can be frustrating and disheartening for lots. That's why in this video, I will show you an often missed cause and diagnosis of dizziness that can make all the difference in getting a speedy recovery. Hopefully this can give you hope and point you in the right direction. In my practice, I've adopted the role of subluxation hunter, if you will, emphasizing the importance of having one's spine examined for vertebral subluxations and postural distortions. But what exactly is a subluxation? Well, picture two spinal vertebrae together, like this model, representing a mechanical relationship. Now, the green light signifies strong nerve signals, indicating, a smooth go for bodily functions and messages. However, even the slightest shift in position can trigger irritation along the spinal cord and nerve roots, symbolized by the red light. This irritation disrupts the flow of electrical signals from the brain and spinal cord to various, if not all, parts of the body, including muscles, organs, and tissues. That's a subluxation. Now, they're not singular occurrences. Multiple subluxations can occur simultaneously, leading to various consequences influenced by physical, chemical, and emotional stressors. What are these consequences? They can include impaired stress adaptation or handling stress poorly, compromised posture, which can also contribute to subluxations. It can be an issue with nerve and proprioceptor interference, affecting your balance, positional awareness, There can be local inflammation, pain, and disruptions in organ function due to that altered nerve signaling messaging. The repercussions of subluxations extend beyond physical discomfort. They can also manifest as dizziness, particularly when subluxations occur in the upper cervical spine. In these cases, subluxations can impede or block or reduce blood flow to the skull and brain. They can interfere with neural control of the eyes, ears, nose, and affect your visual focus abilities. Additionally, subluxations in the lower neck and thoracic spine here can aggravate and cause strain on the upper neck, leading to postural strain, dizziness, and related symptoms. Detecting and addressing subluxations requires a comprehensive approach. Through a series of tests, including posture evaluation, balance assessments, computerized nerve scans, and full spine x-rays, chiropractors can pinpoint subluxations and tailor treatment accordingly. Now, specific adjustments target identified subluxations, aiming to alleviate or reduce the nerve interference and address the root causes of various health issues like dizziness. It's important to distinguish between specific and non-specific adjustments. While non-specific adjustments are beneficial for addressing general stiffness or immobility in certain areas of the spine, they're great. Specific adjustments delve deeper. They target specific subluxations associated with particular symptoms and conditions. Thorough testing, including full spine upright x-rays, they've got to be standing, it's crucial for identifying these specific subluxations, which may not be evident through touch or even other diagnostic methods alone. Now, chiropractic adjustments are often associated with a cracking sound known as cavitation. It's a release sound. Although this sound may accompany many adjustments, it's not always present and not necessary. Most importantly, adjustments should feel gentle and relieving, providing a sense of release, and often leading to an overall improvement in well-being. While some individuals may experience brief soreness following adjustments, many leave feeling revitalized, as if they've received a turbo boost to their health and vitality. Callie gets credit for that turbo word, if I'm sharing credit respectfully. In a moment, I'm going to demonstrate two specific chiropractic adjustments to the neck and the upper thoracic spine, the same adjustments I do with my patients. Before I do that, it's time for today's recovery spotlight. Today's recovery spotlight story is about Xingyan. She was a university student at the time and presented with dizziness, balance issues, lack of mental clarity, and recurring fatigue episodes after receiving 3 moderate concussions, university time. They were diagnosed, but it didn't lead to any brain trauma, thankfully. Now, most of the time, she was treated through physiotherapy, which would definitely help her moderately, but the symptoms would keep coming back in more stressful times, exam times, competition times. She hadn't had upright x-rays or nerve scans, and no one had thought to suggest chiropractic care for her concussion symptoms. Might have been thought about, but it really didn't follow through. While they were mildly aware of the involvement of her neck, it wasn't assessed thoroughly either. Fast forward 2 years. We performed a full series of tests, scans, and x-rays, and found some subtle but distinctive subluxations in her upper cervical spine that needed specific adjustments. We did just that. I seem to recall from her notes it took just under 3 months of consistent adjustments for some symptoms to start reducing, and quite notably her dizziness and mental clarity were the first 2 to improve after more than 2 years of symptoms. Needless to say, she felt much better, and what I noticed as the observer was her attitude, her inertia. She was just happier, she smiled more, her focus and attention were sharper. Now let me show you 2 specific adjustments to the cervical spine, thoracic spine for dizziness, just like I did with Xingyan and many others. So I'm about to do 2 specific adjustments in the upper cervical and upper thoracic that are the same adjustments that I perform when patients specifically have dizziness going on. I've done a leg length analysis. I've identified where those adjustments need to occur. I set the tension on the table. One hand is the support hand, the other the adjusting hand, the edge of my hand. And the setup brings the head into a relaxed, tilted position. And then it's just a follow through line of drive Table makes the sound, not the patient. And the second adjustment, in the upper thoracic, which triggers a postural shift affecting release and relaxation for the upper cervical. If you take a breath in and out. Good. Adding in additional drop movement, breath again. Just lower and out. Excellent. And those are the two adjustments with the right focus. Okay, so what I didn't mention in that video, I use a drop table, and it's the Thompson terminal point technique. Table elevates ½ inch or less up and down when it's set and drops. This enables a gentler adjustment in most cases, and the lack of rotation increases safety levels, increases comfort levels, and even alters the cavitation sound that some adjustments might make. Okay, now I want to hear from you. Can you share your experience with dizziness? What did you do for it? What worked for you? What's still not working for you? What are your frustrations or worries about your dizziness? Leave a comment, share your thoughts. If you found value in this video, do share the video so others can get access to it. Remember to subscribe if you want to enjoy a more comfortable and active life with better posture, increased mobility, and free of chronic pain. The next video I suggest you watch is this one, where I talk about the 4 main causes of cervicogenic dizziness. It's really important. If you've been suffering from dizziness for a while, especially, I go into more details about how problems with your cervical spine, neck, posture, muscles can be main causes of dizziness. Go watch this video right here.